Hello, and welcome to the Simply Business Interview Podcast, a podcast created by business owners for business owners. I am your host, John Jennings. I believe that most business owners are working way too hard for much too little. And one of our issues is that we overcomplexify things. I believe the answers are almost always within us or within our reach. I like to say that I'm a simple man with simple ideas. So welcome to Simply Business. Okay, today we are joined by Dr. Christy Watson of the Body Bar, MD. Looking forward to hearing her story and some of the things that she has overcome and some of the things in their future. So, Dr. Christy, why don't you first introduce yourself and we'll go from there.
Hi, thanks for having me. I'm Dr. Christy Watson. I am an Indiana native. Raised in Zionsville, Indiana. Went to Indiana University School of Medicine, and have really been practicing here since I got out of med school. I have a really kind of a lifelong interest in wellness, nutrition. I was a gymnast and a diver, so that's kind of a big part of of growing up, paying attention to those things. And when I went to med school, I actually thought that's what I wanted to do, small town family practice, back when Zionsville was actually a small town, and really focus on wellness and prevention and preventative medicine. Took me quite a detour to finally get to that. After med school, I did work in the emergency room straight out of residency in internal medicine, and have continued to work what we call PRN on an as-needed basis in the ER. But in 2014, I started what was Live Like Clinic at that time. We now are our Body Bar MD to really kind of better get an idea from a brand standpoint of what it is that we do. We started off as I started it off as a pure weight loss clinic in 2014. Yes, long before all the new era of weight loss that we're currently in.
It's a little harder to do weight loss back then, wasn't it?
It was, but I am fortunate. I am very blessed that I have patients from they were probably some of the first patients I ever had. And they still have the folder we gave them and all of their in-body scores and all of the little handouts and homework that we gave them, 10 years later. Still following a lot of the principles that we were doing then. And, over the years, that's really where it makes that switch. When I decided to open my own, I don't know that I ever knew that that's what I wanted to do. I knew I wanted to help people. I knew I wanted to do this kind of medicine. But as most doctors will tell you, it's just not a part of our training. I mean, business is a very, we learn how to bill insurance.
Right.
But we don't really learn much, if anything, about the actual business side of medicine and being an independent practice. So it has taken me a long time to make that transition, to have that dual role of being both the doctor, but then also having to put on that business owner's hat, and act more like a business owner.
Yeah. Well, independent medical providers are fewer and far between now. I mean, growing up, we all had, you had your local doctor, your local dentist, your local everything. And now that more and more, everybody's being absorbed by these systems. So,
yes, I think it's across the nation, it's less than 20% of physician practices are independently owned.
Yeah, I'm sure of that. In fact, I would guess it's significantly less. At least around here, it seems like it's significantly less than that.
Yes, it's kind of interesting. Dentists are much more entrepreneurial and have stayed relatively independent,
Yeah.
whereas medicine has gotten less independent.
Yeah. You think that's partly because of the, like, I know when EHRs were mandated, a lot of doctors said, "Boy, that's just a financial leap I don't want to make." That's where I saw a lot of them uh, leave
I
the independent sector then.
I think that was a part of it. I think the biggest thing, and this is again where dentists were far, far um, later on this. It was when we added insurance. You know, if you think about your old family doc, you might have traded chickens with them or traded eggs with them for care. It was just you had that direct relationship between your wallet and the care you were receiving. Well, when we
Mhm.
put the third party in there, that's, in my opinion, when everything started to change and we started
Yeah.
playing this big insurance game.
Yeah. Yeah. It's yeah, it certainly has complicated things for sure. So,
Yes, it has. And it just changes, it changes the way that you maybe interact with the patient or the treatments that you choose, as opposed to being an independent physician. Um, I still practice medicine that's best for the patient.
mhm.
Um, and certainly I still have to make money, just like a nonprofit corporation still has to make money. No
Mhm.
money, no mission.
Right.
But I'm not tied to a system. I can
Mhm.
choose the best provider for a patient outside wherever is best for them, not based on kind of what somebody tells you to do.
Right. Right. So you start off as pure weight loss and you've expanded into some wellness and some other areas. What are some of the other areas you cover?
Well, so it from weight loss, it kind of went to aesthetics, which is going to be that whole array of body contouring and Botox and fillers and
Mm.
laser treatments and certainly wellness, because again, once somebody starts feeling better about themselves and they're looking so much better, they want the rest of the way
Mhm.
that they appear to follow that. But the biggest addition that we have done is hormone management for both men and women. So TRT for men and menopausal and perimenopausal hormone therapy for women has been an absolute game changer. From for me professionally, I have seen the biggest impact on people's lives.
Yeah.
Uh,
Also, tell me a story. How does that made a big impact on them?
Well, it's been really underestimated, the menopausal symptoms that women are having. Now, men will have them, but in typical male fashion, it's a little bit more subtle. A male might just say, "Well, I'm tired." And then
Mhm.
they go, "Well, it's because I'm older. I didn't sleep well. I'm stressed out at work," when it really is their testosterone. But men aren't men aren't used to interacting with healthcare as much as women are. They're not as in tune to their bodies, their periods, and everything else. Well, women start having symptoms in perimenopause at a good 8 to 10 years before they actually ever go through menopause.
Right.
And they have often been told that their symptoms are not valid. They
Mm.
have been told that they're crazy. They've been told they're depressed. They've been told they just need anxiety medicines, antidepressant medicines. Um, they have fibromyalgia. They have all of these other things, and they never end up feeling any better. And it was their hormones all along.
Hmm.
So, I mean, the most common thing and the most dramatic thing that we'll see is somebody come back to us and say, "I actually feel like me again. Like,
Hmm.
you gave me back. I got my marriage back. I got my intimacy back."
Hmm.
Um, I think the statistics are as many as 20% of women are struggling with intimacy in any form in the bedroom because of pain, because of dryness, because of symptoms, and they don't have anywhere to turn. So, when somebody comes back in and says, "You gave me my life back," I mean, that's why
Yeah.
we went into medicine, in my opinion.
Right. Right. It's good.
And then all of the other things have come from that. When you've given somebody their life back, you've established a relationship and a trust there that is really, you can't measure it.
Yeah.
And so that's often how it will progress to some other services.
Okay. Cool. So tell me about why you started this. I mean, you had you were doing the ER doc thing, which you still do some, and I know that's a challenge. I know some ER docs. That's a unique, completely different model from obviously what you're doing. So
Completely.
what really motivated you to go this route?
Well, I think there were a couple of things. My dad is an entrepreneur. He is an accountant by trade and then is a business broker now. So he helps people
Hmm.
buy and sell businesses. And, so there were little nuggets of that, but I think that entrepreneurial spirit was there.
Mhm.
And I think a lot of it was really, there was a need. I mean, at the time, again, 10 years ago, there were not a lot of weight loss clinics. It was
Mhm.
you had surgery or you just lived with it. So I saw a need. And I opted to go cash even then and not go the traditional insurance medical model because I felt like we could keep the services affordable for anyone and still get the services that they wanted. So I wanted the medical piece of it, but I also wanted to be my own boss. I wanted to be able to make the decisions. I don't want to
The
have to go
call of
through.
so many entrepreneurs, right?
Yeah, I don't want to go through 10 meetings to get told to wait 3 months and then something get forgotten about to actually implement one tiny little thing.
Right. Yeah, that's healthcare in a nutshell there in the big systems for sure.
Yes,
Yeah.
yes.
Okay. So you get started, and what were some of the early surprises of starting your business? I mean, you had this kind of dream of working for yourself and no meetings, but what
You
really
know,
happened?
I mean, again, to me, I will tell people the medical part of it was relatively easy because that's what I've been doing.
Yeah.
It's simple things like you don't, when you work for a hospital, you just get a paycheck and you don't have to think about it.
Yeah.
But it's things like compliance, education. It's HIPAA. It's making sure that you're keeping up to date with some of the compliance things, that you are following all the rules. You're not setting yourself or anyone else up for there to be trouble. And that's again more on that kind of medical legal side. On
Hmm.
the business side, it was just all those little things like, oh, you mean the supplies aren't just like waiting in the cabinet for me when I walk in the room?
Yeah.
And so, it's dealing with vendors and then sales calls and all these people that want a little piece of you. It's easy to get distracted by shiny objects.
Yeah. Yeah. Well, and that's the entrepreneurial gift right there, right? Most entrepreneurs, just by the way they're wired, they're constantly, we always joke about, squirrel, they get distracted by,
Yes.
everything, the shiny object syndrome, whatever you want to call it. You got to stay focused every now and then to get work done.
Yes, that piece. And um I think having to, the whole being a boss and the employee, trying to make everybody happy and then realizing that you can't make everybody happy and learning to not take that personally. There's a
Yeah.
lot of uh shields and guards that I've had to put up over the years that I just had no idea about.
Yeah. So, so when you realized you couldn't make everybody happy, um, one, how did you handle that? And two, you know, is that freeing now that you had that realization?
It's very freeing now.
Yeah.
After doing this much longer, you know, it still hurts because you think, gosh, I felt like I was a good boss. I felt like I was a good employer.
Hmm.
Um, And so there's still a little piece, but I'm old enough and wise enough in this space now to just go, people, everybody's got their thing, and you can't make everybody happy. So I'm much less affected by it
Yeah.
than I was before, for sure. How I handle it now, I give it to my practice manager.
Well, delegation is one of the cornerstones of being a good CEO, right?
I again have learned that the probably the hard way, but it cannot be understated, the importance of building a good team around you and one that you can trust.
Yeah.
That is probably my biggest lesson out of all of this.
Yeah. That's a great one. And let's dive into that a little bit because you offline before we did the recording, you said that that driving the culture the way you want it to be was kind of one of the challenges. How so?
Well, it's still sometimes I have to step back and remind myself, um, you know, not everybody has the same work ethic and the same drive.
Okay.
Um, and no one cares more about your business than you do, and you simply can't make them.
Yeah.
And so I think it's been one more of, I'm not a punitive boss where, work harder or else. It's not something
Hmm.
like that. But I think it is keeping it a place that is enjoyable to work.
Hmm.
Most of my staff will say, I've worked at the hospitals, I've worked at other places. This is easy. This
Yeah.
is happy medicine. It's an enjoyable place to be, and I think it starts with that. And then I think it's again having a practice manager in place that knows she is 1,000 times better than I will ever be at being able to be. I can joke with you, and I can be, somebody that is your colleague, but
Right.
also can put I'm still your manager, and I need you to bring it up a notch.
Hmm.
Again, not that you're doing something wrong, but hey, we just expect a little bit more. And I think the people that we have hired now, um, they they want to see that. They're starting to see that for themselves, and I think that just takes time, that they see when I'm happy and my day goes smoothly, and when the practice, when those things go smoothly, they're happy. Their day's a piece of
Yeah.
cake. So it's that added incentive of, hey, when we're doing stuff right, we don't get yelled at. We don't
Imagine that.
nobody says anything to us. We go on about our day. And I think some of that is also paired with a lot of flexibility.
Mhm.
We have, I think that really has been another piece that has been really vital, is understanding that work life balance.
Mhm.
Sometimes it gets tilted too much one way or the other way, but I think
Right.
when people know that they're respected as human beings, they're valued as employees, their opinions matter, but that their time also matters.
Mhm.
I think those have been things that have really made a big difference in the core staff that we have now.
Yeah. Yeah. I don't like the phrase work-life balance because there's no such thing as work-life balance. There's that idea that, oh, I'm going to have as much time at home with my family as I have on the job. That's just never realistic. But I do like the idea of work-life alignment, that we
Yes.
we align it with our value, and so when I need to be all in at work, I'm all in at work. But when I at home, I can be all in at home. And in fact, I
Yes.
just a social media post on that this morning. That it's just one of those things that's every once in a while we all get kind of off course with that. We have to
Oh,
remind ourselves.
absolutely. And it's even things like, hey, somebody has to go and pick their kid up because they're sick. Okay. It's, again, I go back to my practice manager because if somebody leaves, she will step in and do their job. And so, and they've seen the same thing for me. If I need to
Hmm.
set up a tray, or I need to set something up, or I need to clean something, I'm in there cleaning it. I don't, if I need to clean the toilets, I'm cleaning the toilets. So it's also knowing that it isn't like, oh, I'm up here and everybody else is down here. It's like, hey, there's a job that needs to be done. We all get it done better together.
Yeah, yeah, and that's not everywhere.
No,
Actually, that's another. I just had a conversation with a client who's having a. Actually, the bathroom example came up as a, you know what? There's a mess in the bathroom, and everybody's just walking around it instead of dealing with it.
100% drives me crazy.
Yeah.
Yeah, they know most of the time if they can't find me, I'm in the break room cleaning dishes.
That's cool. So you're walking the walk, talking the talk, as they say, or walking the talk. Uh,
Yeah. And
yeah.
and I think we're also fortunate though that we have great patients. Our patients are friendly to our staff, and so our staff is friendly to them. We don't I do think it starts just the way the first people that greet you when you walk through the door.
Mhm.
We have never let that be, oh, we're just sitting here, we're busy on our phone, not paying any attention to you. It's always been, you're the face of this
Yeah.
place when they walk in, and I really need you to engage with them. And trying to frame things, I just think positive works better than negative.
Yeah. Yeah. When I do training and stuff with medical practices, I'll talk about to the frontline people that very thing. I mean, I've been going to the same doctor for, oh gosh, the doctor's turned over, but 35 years, something like that. And the
Mhm.
lady at the front desk is still the same person.
Yeah.
I mean, she doesn't age. She's like, you need to figure out her secret. I don't know what her secret is. She doesn't seem to look a day older, but she's been there. Her name's Linda, and I know she's going to greet me every time I walk in. One of these days, she's going to retire, and it's going to change everything. But
Well, and you know what? It'll take two people to do her job.
probably, probably so. But yes, 'cause she knows everything about it. So anyway, that's
Well, but
so true.
that's also culture of someone making her feel the importance of that front entrance, as opposed to, well, you're just the front desk assistant. Your voice doesn't matter.
Yeah, yeah. She
And, and
obviously hasn't. I don't think she's ever been told that, obviously, or she wouldn't believe it if she did hear it.
that's exactly right. So I think that goes a really, really long way. I think the
Oh yeah,
hospitals could learn an awful lot from that mentality.
absolutely, absolutely, and I see that in a lot of practices. they'll they'll pay a lot of attention to the providers and the medical assistants and the nurses, but whoever can just get a receptionist for the front desk. Just
Yeah.
anybody's, and
Yeah.
that's
And I think the the next challenge that we are facing, and again, I think this happens with a lot of places, is, as you grow or you want to grow, you have to bring on more staff. And
mhm,
then all it takes is one bad person to ruin that whole vibe.
yeah,
I am still shocked to this day at how one person can bring down the whole office.
yeah. It takes it to build a strong culture. It takes a strong leader, but also a team that believes it and follows it. To destroy a culture, it can just take one loud person.
Yes, yes, yes. And yeah, and we've, I think we've gone through that just like every place else has.
Sure.
Every other small business owner has been through that. But it's also knowing to catch it early and get on it sooner rather than later, before it,
Yeah.
really it becomes an infective virus.
Yeah.
And I think it's important. One thing I'm not great at is the and again, I am sure I am not unique in this, because I'm thinking about revenue generating things. So that means
Mm.
I've got to be doing this and this and this because that generates revenue. Taking that time out to hold a staff meeting or to do education or to do process and operations,
Yeah.
in my mind, it doesn't generate revenue. So it's hard for me to put the stop on and go, no, you have to do
You
this.
have to do it. Not every day, but
No,
you have to carve out some time periodically to do that.
yeah.
I've yeah, and I've worked with some clinics that would shut the clinic down for a half day, just to work on culture and things like that. And it's
Yeah.
important.
Yeah. I think you almost have to because everybody needs that little break too.
Yeah. So you mentioned growth and some of the challenges. So what are your growth plans, and what are some of the challenges you're seeing ahead?
Um, my fear with growth is always, again, as a typical business owner, it falls on my shoulders. Like,
Mhm.
okay, we can book more patients, but that means I have to have somebody else, I have to have another provider, which means I'm paying them. And maybe for 3 months, they're not fully booked. So
Right.
you might lose some money in the interim. Do you have that balance to be able to do that? And can you guarantee that growth is going to be there? So there's always this fine balance between, okay, we've worked the expenses and we're as lean as we can go. Well, now we have to grow and making sure that those align together with profitability and all
Yeah.
of that. And then, as I mentioned before, finding new staff that fits the brand and the
Mhm.
culture that we have here.
Yeah.
We already know that we're expanding. We have a building that we're going to be going into in a year, so we know we're doubling our space.
Oh, wow. Okay. Congratulations.
So we kind of know that that's coming on the horizon.
Yeah.
So I guess in some ways, I have a little bit more time to plan for it than maybe other people would. And
Now,
I
is that
think
at your main location?
yes, at our main
Yeah.
location, we have great space at our Terre Haute location and room to grow there.
Mhm.
So it's a little bit more like it's kind of I don't want to say autopilot, but it's a little bit like we've gone through our big growth there,
Yeah.
at least for now, for the near future. We are busting at the seams in Carmel,
Okay.
and really trying to figure out how to use more space with what we already have. But again, for me, it's the fear of just, okay, I bring somebody else on, there's training, there's expense. Are people going to like them? Are they going to be able to, again, kind of fit the brand? We're pretty picky.
Yeah.
So I think that's the biggest thing. And then as we grow, making sure that we don't lose that, still like you feel like you're walking into an office that's your family.
Yeah.
I don't want it to feel sterile. I still want it to have that small feel that we know everybody. And I think as you physically expand your space, it's easy for that to kind of go away. Because right now we're
Mm.
all right there. If I'm walking out to go to the bathroom, I'm saying hi to patients in the waiting room.
Yeah.
And so there's that presence, and I don't want this to be like, oh, everybody's in the back behind closed doors and we just walk into the room and see you and that's it. So those are the things in my mind that I think about. It has more to do with the culture growth, and then the certainly the financial piece, but I
Yeah.
think we'll get there.
Yeah. So if folks are interested in learning, maybe what you talked about, the hormone therapy and other things, people go, oh gosh, I'd like to find out more. If they're in in Indianapolis, Carmel, Terre Haute, where else are
Fort
you?
Wayne
Fort
and
Wayne.
since and Aurora is actually down near the Ohio border, right in the kind
Yeah.
of the Cincinnati Valley area.
Okay. So you're kind of all around that central Indiana region ish.
Yep.
And so Body Bar is the name of the brand. So they find that on online and
Yep, Body
find the
Bar
place.
MD. We're on Facebook. We're on Instagram. We have a YouTube channel. Our website. Our website actually is brand new, as in like a week old.
Oh, wow.
So we've got a lot of good information in there. And actually, now that we got that, we plan on having an even greater social media presence.
Cool. Very cool. Well, Dr. Christy, thank you for coming on the program. Got a great story to share, and I love the fact that even though we could have talked about all kinds of things around weight loss and hormone therapy. I mean, you recognize it's a business, and and what you're focusing on is culture. And that's you see how that kind of intertwines its way through every aspect of your practice, and that's cool that you recognize that. So thank you.
Absolutely. Well, thank you so much for having me on. I appreciate it. And it's nice to, like I said, do something outside of medicine. It's important to think as a business owner, and that's not always easy to do. So I appreciate you having me on.
Great. Thanks very much.
Thank you. Take care.
Thank you for listening to today's episode. If you liked it, please share or like it on whatever platform you use. You can find me on social media. On most platforms, I'm John K. Jennings. My first book is also available. Your Baby is Ugly tells you about 10 truths that business owners need to hear, but often won't, and how to overcome them. You can find it on Amazon. Just search for Your Baby is Ugly. And be watching for our next episode, where I'll interview another business owner who will share their stories and insights into what it's like to create a great business.